They exist on the fringes of urban areas throughout the developing world. They are created by people needing a cheap place to live. These crowded communities are devoid of the normal necessities of urban living: drinkable water, good sanitation, clean conditions. In India, they're called bastis, or in common English, slums. On the outskirts of the modern city of Chandigarh is the basti called Janta Colony. People have come here from rural villages, looking for work, looking for a better life for themselves and for their children. Ironically, their ambition of having better lives is being thwarted by their having created this overcrowded community. There are always problems to deal with. Urban poverty has its own set of serious problems. Sanitation is lacking.
यहाँ पे ना बारिश में जब होता है ना, यहाँ बारिश होती है तो बहुत बुरा हाल हो जाता है लोगों का। घरों के अंदर गंदा पानी अंदर घुस जाता है, वो सारे कीटाणु खाने के अंदर भी जाएंगे, उसकी वजह से कितनी बीमारियां फैलती है। बुरा हाल है यहाँ का। जब अभी दिसंबर में ये हाल है तो आगे क्या हाल होगा वर्षों के अंदर, आप खुद समझदार हो।
Janta Colony has many such waterlogged areas, which are the breeding grounds for mosquitoes. Consequently, there's a higher concentration of mosquito-borne diseases such as malaria and dengue fever. A survey showed that 55% of residents have malaria or have had malaria. A non-profit organization, Developing Indigenous Resources, DIR, is enabling the residents of Janta Colony to solve their most serious problems by providing them with the necessary knowledge and skills.
Of the many problems that we have in Janta Colony, I would say probably ignorance is the greatest one we have. We have smart people living here, not stupid people, but they haven't had education and they don't understand some of the things that we understand about living and how to have a healthy life. And you see that manifested in 101 ways. You see it in the open sewers that we have here, that the people are not protesting about. In other societies, a little more education, people be pushing government or pushing somebody to put the sewers underground. Here they're on the surface. And here we see pigs. We have a pig population of 621 living in the colony. These pigs go in and out of the sewers, spreading disease in ways that are horrible to think about. The biggest single problem that these pigs present are gastroenteric diseases. So these are diseases that come from ingesting various pathogens that make you sick.
These pigs are only part of the busti's livestock problem. Cattle and chickens living in close proximity to humans also feed on filth and garbage and pass on diseases. Basti children are at the highest risk of catching diseases such as gastroenteritis, dysenteries, parasites.
Yes, well, very, very simple model, really. It deals not with curative medicine, but with preventive medicine. And as you probably know, many of the diseases that we have here, that the people have, the illnesses they have and the deaths that they're having are totally preventable. And we haven't surveyed them exactly here, But in other areas similar to this in which I've worked, we've discovered that 83% of the diseases that the people had were all preventable. And preventive medicine is very cheap, of course. And it not only do you prevent the suffering, but you prevent the huge expense as well. Very unfortunately in India and many developing countries, the government has focused its attention on curative medicine, which is expensive, and patently it's a bad idea. You wait until people get ill, and then you try to cure them, which is hard to do, and not always successful. But if you can prevent the disease, you prevent the suffering, you prevent the expense. And so the essence of our model is prevention of disease, and then how do you do that? Well, we do it through working with the people themselves.
Total immunization is a prime objective of DIR. Another important aspect of the DIR model is spreading awareness of how to achieve improved health conditions. Let's see what the local people have to say about DIR.
12 साल हो गए हैं, तो यहाँ पर भी ये लोग यहाँ कर काम करते हैं बीच बीच में, तो कैसा लगता है, कुछ फर्क पड़ता है?
बहुत अच्छा लग रहा है।
अच्छा,
काफी फायदा हो रहा है और काफी सफाई भी हो रही है।
अच्छा,
बहुत अच्छा।
और टीके वगैरह ये लोग लगाते हैं तो?
बहुत ही ध्यान से लगाते हैं।
हाँ, तो पहले
पूछ के लगाते हैं।
अच्छा,
जा के।
ठीक है। अच्छा, और जो सरकारी यहाँ पर पहले मतलब सेवा होती थी हेल्थ की, उसमें कैसा था?
उसमें तो एक ही जगह पे गाड़ी खड़ी होती है, जिसका मन जाओ। वहाँ तो जी बड़ी सुननी पता भी नहीं लगता था।
अच्छा, तो इन लोगों का कैसा रहता है?
बहुत अच्छा।
तो क्या फर्क लगता है कि सरकार वाली और इसमें क्या है, कैसे मतलब?
बहुत फर्क है, ये फर्क है कि घर जाके एक को पूछते हैं।
अच्छा,
2 बारी जाते हैं। अच्छा, जो नहीं भी निकलता फिर जाते हैं।
अच्छा,
काफी।
In the relatively small area which is Janta Colony, 9,240 people are crowded together. Of the 937 children under the age of 5, over 700 are severely malnourished. A major focus of DIR is a comprehensive nutrition program in which mothers are taught to make nutritious meals at very low cost. The accomplishments of DIR in Janta Colony are many. Perhaps the greatest is the changes in the attitude and the change in behavior of the people as they learn that their actions can beneficially affect their future. In terms of things we can quickly quantify, DIR staff have had all, that is 100% of the young children immunized against diphtheria, tetanus, tuberculosis, measles, polio, whooping cough, and hepatitis B. This is an accomplishment of which few communities in developed nations can boast. Before DIR came to Janta Colony, many people had never seen a dentist, and the dental health of most residents was very poor. Now, a new program conducted jointly with a neighboring dental college offers free examinations and free dental treatment to everyone in Janta. Dental education classes are conducted for everyone, and DIR is obtaining and distributing toothpaste and toothbrushes. Over 75% of new births now occur in clinics or hospitals, compared with less than 10% before DIR came. All young mothers now get antenatal and postpartum exams and treatment. Educational programs are in full swing, and microloans are being made available to those who want to start their own small businesses. While we are happy with results here, We are planning new programs in other equally poor neighborhoods and are seeking funds to implement the same kind of self-sustaining programs. During the last 3 years, DIR has transformed many lives within Janta Colony. There are many other similar slums in the area. DIR has the methods, but not the financial means to replicate the program in other needy areas.